Doctors under the umbrella body of the Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU have expressed frustrations over lack of engagement by both the national government and county governments on what they term as key health concerns that they highlighted during their 7th Special Delegates Conference held last month in Nakuru. As Grace Wangui now reports, KMPDU Secretary General Davji Bhimji Atellah says the two-level of government's failure to address their demands will see doctors down their tools of trade effective January 2023.
Kenyans seeking medical assistance from public hospitals may be in for a rough ride come January 2023 if the industrial action called by Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU is followed through. Frustrated doctors under the umbrella body led by their Secretary General Davji Bhimji Atellah say they will follow through with downing their tools come January 2023 if stakeholders including Ministry of Health, county government and parastatals fail to meet their demands, as highlighted during their 7th Special Delegates Conference SDC in Nakuru about 3 weeks ago.
The absence of this, KMPDU reiterates that the industrial action that has been contemplated and the notice has been issued will actually go on, and we will have to go on strike or to carry out any other industrial actions that we deem necessary in the month of January. And we want to tell the public that when that happens, it will not be the doctors who are on strike. It will be the government, both the national and the county government, that are on strike. Because giving them 30 days of notice for engagement is sufficient for a resolution.
Top of their grievance is lack of the implementation of the 2017-2021 Collective Bargaining Agreement, CBA, which according to them has seen stakeholders ignore basic salary adjustments, fail to post over 1,000 medical interns, fail to create call rooms and lack of constant consultations that will make industrial harmony possible.
KMPDU signed a collective bargaining agreement with the national government and the county government in 2017. This happened after a protracted strike of over 100 days. It left many Kenyans suffering, and we see that the national government, the county government, and the parastatals have forgotten this. And this is the reason why most of this CBA, if not all of it, has remained unimplemented. And particularly, we have the issues of the Article A of the CBA on the basic salary has remained unimplemented over 5 years.
According to Atellah, the country faces extreme shortage of doctors, which has led to suffering of patients who have to make long queues to get access to treatment, and yet there are many unemployed doctors. The union is now calling on national and county governments to urgently absorb all unemployed doctors and distribute them to public hospitals.
The country has specialized in training and dumping the doctors. We have over 9 universities that are continuously training doctors. At the same time, we have over 5,000 unemployed doctors. So this has made these doctors to be frustrated. They have bewilderment of frustrations that they cannot pay any bills. They are frustrated despite having used the taxpayer money to be trained for all that period.
The doctors have yet again called for the establishment of a health service commission who will be mediators between counties and health workers.
The establishment of health service commission, the government promised that there will be mediators between the county government and healthcare workers to see the establishment of health service commission within 100 days. We are demanding that the government need to take this into action so that we can see industrial harmony in the training and employment of the doctors.
Health workers in the country have for years decried that their concerns go unmet by the government, with the latest ones in Mombasa calling off their planned strike after the county government agreed to hold talks with them.
Show boy! Show boy!
Grace Wangui, for TV News Watch.
For the union makes us strong.